Hello everyone, peace be upon you. I am Abdul Raouf Al-Maname from the Islamic University of Gaza. I'm going today to list the factors that increase the risk of spreading infectious diseases during this genocidal war on Gaza. Before we do that, we shall have a quick overview of the chain of transmission. We have for any disease or infectious disease, we have 6 components: the microbe, the reservoir. The microbe has an exit rule from the reservoir, and then find a mean of transmission or mode of transmission. Then it have to be going inside a susceptible host. These components, at any point we can prevent the transmission chain by breaking at any of these points. This is in normal conditions, but in wars, usually the war magnifies the effect of each of these components, and we will see how later on. The spread of disease in war is one of the major health challenges facing affected communities like people in Gaza. The difficult conditions that accompany wars and natural disasters in general, such as the lack of food and clean water, the deterioration of healthcare services due to either destruction or limited resources, greatly facilitate the spread of disease, especially those that are transmitted through infection. Diseases that are more prevalent in these conditions may include those that are transmitted by contaminated water and food, and those are insect-borne diseases. Those through contaminated water and food, like cholera and typhoid, and many other diarrheal diseases. We call it the oral fecal transmission pathogens. While those through insect-borne diseases may be rickettsial diseases, which is very common during summer usually, and early autumn. Also, the respiratory infectious diseases such as tuberculosis and pneumonia, and maybe COVID-19, maybe influenza, and many other respiratory viruses may spread rapidly in crowded conditions. Skin disease is also very common, and we have seen this summer in Gaza very commonly spreading, and many of the patients has suffered from staphylococcal infections that really were severe and has led to sometimes septicemias, and some has led to fatalities. Mental illnesses as a result of course, the health crisis, such as the loss of loved ones and properties, and also the harsh conditions lived by the immigrants. All of these can really lead to mental illnesses. Now we will go to the core of this presentation, which are listing the factors that affects or influence the increase of infectious diseases during wars and disasters. Displacement and overcrowding. Of course, displacement means that the people are away from their home. They may contact new environments. Overcrowding facilitates the transmission of any disease. The displaced people, we have to focus on two major or three major components. They are away from their houses. They are under stress. They do not find the proper food and water. These 3 or 4 factors, alongside with the overcrowding, is a great combination for the spread of infectious diseases such as cholera, measles, respiratory infections. Poor hygiene and sanitation, which is really also a very vital factor. The Israeli bombardment of sewage systems, sewage treatment facilities, even the drinking water networks has led to contamination, scarcity of drinking water. These factors usually produce a great environment for the propagation of environmental bacteria, viruses, and parasites, and may influence the spread of cholera, typhoid, and dysentery. Unfortunately, the destruction of laboratories, medical laboratories in particular, and public health laboratories have made it difficult to diagnose exactly what are the diseases that are prevalent in Gaza Strip. Collapse of the healthcare system, as all of you know, that almost 90% or maybe more than 90% by many reports of the healthcare facilities were targeted by the Israeli either by invading or by bombardment of these facilities. This, of course, will delay and hinder the diagnosis, treatment, and immunization efforts, which can lead also to the spread of diseases. Malnutrition also is a vital factor that may contribute to the spread of infectious diseases. As all of you know, that food, proper feeding is essential to health and to immunity. People with malnourished has greater tendency to be infected because of their lower immune system. And this is not a new fact, it is a very old fact. And since the tuberculosis epidemics during the 30s and 20s, it was known that malnourished people are more susceptible to tuberculosis than other people. So nutrition is a very important factor, and it is a very prevalent in Gaza Strip because of the siege, which prevented the entrance of many vegetables and fruits, and even all types of meats were prevented in periods of times. There are some effects of malnutrition and immunodeficiency: increased rates of infectious diseases. Usually people with weakened immunity as a result of malnutrition are more susceptible to respiratory disease, as we said earlier. High mortality rate are associated also with malnutrition. Epidemics are spread faster in crowded gatherings such as camps. Disease spread quickly among vulnerable groups, especially those with malnourishment. There are also other effects of malnutrition: impaired physical and mental development in children. It may also manifest as a developmental delay or decline in cognitive skills. Weakened muscles and energy as a result of protein deficiency also increase the likelihood of diseases. Mental and psychological effects: malnutrition also causes psychological issues such as depression and stress, which also can lead to poor overall health and may impair individuals' ability to cope with difficulties imposed by the crisis. And as we said, it may also lower the immune system. One factor also, which is very important, is the limited access to vaccines and medicine. The destruction and the geographical separation and the displacement of people make it really difficult to obtain the proper medication or proper even nationally adopted schedule for vaccination for children or for infants. born during the war. This also may have increase or may increase the chance of spreading diseases such as the measles, for instance. And all of you maybe heard about the isolation of poliovirus from the sewage in Gaza Strip. Knowing that in the past 25 years before war, the poliovirus has never been isolated from Gaza sewage or patients. Population movement and exposure to new pathogens. This is also a very vital factor. Pathogens that has never been encountered by some people, so they don't have immunity for these pathogens. It is easily also, in this case, to contract these diseases. Psychological stress, we have mentioned that earlier, that trauma and prolonged stress weaken the immune responses, making people more vulnerable to infection. And we should know that stress-related effects are particularly noticeable in protracted conflicts, and it is a very long conflict. It is now almost 1 year, or the aftermath of the disaster with prolonged displacement. These also produce psychological stress. Trauma as a result of the loss of homes, property, and loved ones may greatly affect the psychological health of people. Lack of public health communication and education. This may be added to the destruction of the health system. The Ministry of Health in Gaza has its own department of awareness department. This department is not functioning well, let's say, and they are incapable of providing any information to the people on how to prevent diseases or how to cope with the conditions that they are in now. Increased animal-human interaction may be a factor that we have to stress it in this presentation. People are pushed closer to wildlife or domesticated animals, which can lead to zoonotic disease. We have to also to emphasize that almost 60% of human diseases are common with animals. So being close to animals that means we are being close also to diseases that are transmitted by animals. Of course, there are increased interactions with animal because many people maybe are displaced to rural area, and this displacement will bring them closer to wildlife such as rodents, bats, which carry viruses that can be deadly to human. Some people, in their effort to get protein food, may tend to hunt birds or rabbits or whatever animals are there, which are maybe harboring new pathogens that are transmitted to these people. Environmental degradation and habitat loss. The destruction in Gaza is unprecedented. So even animal habitat are destroyed. They are forced to move closer to residential areas in search of food and water, and this may increase also the likelihood of animal and human contact. In short, this war has led to the spread of epidemics and diseases, adding additional challenges for people affected by this crisis. Providing health care and preventing infectious diseases requires a rapid and coordinated response from health authorities and humanitarian organizations in order to protect the health of the population and reduce their suffering. Before I end this presentation, I have to emphasize that hepatitis A was recorded in unprecedented numbers in Gaza during 5 or 6 months. It has been recorded that 100,000 patients were diagnosed clinically with hepatitis A. These numbers has never been recorded in Gaza Strip. And these numbers are thought to be underscored because many people do not go to hospitals for diagnosis because the hospitals are really busy with cases of bombardment, fatal injuries, and injuries that are really very difficult to manage and handle. So many people restrained from going to hospitals. So the numbers that are reported are underestimation of the real number. Thank you so much for your listening to this presentation. I hope I was able to show the factors that influence the increase of infectious diseases in Gaza Strip during this war. Thank you.